Good afternoon, everyone. We're going to start the meeting. I'm going to start the meeting over at the public part. We have a presentation to do this evening to some staff, and then we'll come back and get to the more formal part of the meeting. Good evening, everyone. Bonsoir. Thank you for being here tonight. I'd like to begin by honoring the Algonquin people on whose traditional unceded territory the City of Ottawa is located. I'd like to extend this respect to all First Nations, Inuit and Métis people, their ancestors, their elders, and their valuable past and present contributions to this land. Earlier this year, Ottawa Public Health received the Web Marketing Association's 2019 Web Award for Outstanding Achievement in Web Development for Healthcare Standard of Excellence. This is a well-deserved and much appreciated recognition for the work of employees from two OPH teams who came together pooling their respective skills and knowledge to reconceptualize Ottawa Public Health's inspection disclosure website. Thanks to the work of these key employees from the Digital Health Initiatives team and the Public Health Inspection Branch, OPH is now able to more clearly communicate public health inspections results to Ottawa residents and visitors. By providing the inspection histories for premises inspected by OPH, this website provides residents and visitors with the information they need to make informed decisions about where they choose to eat and drink, swim, register for childcare, and or access personal services in Ottawa. The disclosure website is part of OPH's TEC strategy, which aims to transform the way services are delivered by enabling employees to connect with clients through a variety of modern communication channels. I would now like to invite Katie LeBlanc and Michelle Goulet from the Public Health Inspection Branch, as well as Mie Lebrecq and Jeff Satchwell from the Digital Health Initiatives team to come forward and be recognized for their work on this innovative project. Congratulations again, and we are going to start, as I say, the more formal portion of the meeting. So we'll start with roll call.
Member Banham. Member Cloutier.
Présent.
Vice Chair DiGiovanni.
Present.
Chair Eglai.
Here.
Member El-Shantiri. Member Gower. Member Cavanaugh.
Present.
Member Lakin.
Present.
Member Menard.
Present.
Member Pinel.
Présent.
Member Tilley.
Present.
You have quorum, Mr. Chair.
Thank you very much. And we have no regrets this evening, though I know a number of colleagues are still in the joint planning and agricultural affairs meeting downstairs. Member Lakin will declaration of pecuniary interest.
I, Member Lewis Lakin, declare a deemed pecuniary interest on Ottawa Board of Health Agenda 8, Item 3, 2020 Draft Operating Plan Budget for the Ottawa Board of Health, Document 1, Page 4, Ministry of Health and Long-Term Care Programs and Standards, Chronic Disease Prevention and Well-Being, and City-Funded Programs, Mental Health, Substance Use and Injury Prevention, as a family member is an Ottawa Public Health employee working in these areas.
Thank you. Confirmation minutes of the meeting of November the 4th, 2019. Carried. Thank you. We have 17 communication items that have been received and held on file with the Board of Health Secretary. Can we receive the communications as noted in the agenda? Thank you. I'll ask Member Cavanaugh to move the motion to introduce reports, please? Motion to introduce reports.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer Health verbal report, and the reports titled 2020 Draft Operating Budget for the Ottawa Board of Health, Ottawa Public Health Strategy Plan for 2019 to 2022, update on strategy priorities, and appointment of Associate Medical Officer of Health in camera, personal matters about an identifiable individual, reporting out date upon Council approval, be received and considered.
Carried? Carried, thank you. We'll run through the agenda and see if there's anything that we can all agree on to start. So we'll hold my verbal report, and that will be followed by Dr. Etch's verbal report. Item number 3 is the 2020 draft operating budget for the board, and we have a staff presentation for that. Followed by item number 4, which is Ottawa Public Health Strategic Plan for 2019-2022, update on strategic priorities. We do not have a presentation, though we do have staff available if there are questions. If there are not any questions, we could simply receive this item for information.
I have questions.
Okay, no problem at all. And finally, we have an in-camera item. Item number 5, appointment of medical officer health in camera for reasons of personal matters about identifiable individual, reporting out date upon council approval. So you would have received in your package the confidential report. We can carry that without going to camera if we so choose, or if someone wants to hold it and move it in camera, we can do that at the end of the meeting. Carried? And then we need Member Cavanaugh to bring a motion related to council. Bring this to council.
Whereas the next council meeting is scheduled for Wednesday, December 11th, 2019, and the subsequent council meeting is scheduled for Wednesday, January 29th, 2020, therefore be it resolved that the Board of Health for the City of Ottawa Health Unit requests that Council suspend the rules of procedure to consider the recommendations contained in this report at its meeting of December 11th, 2019.
Thank you. Carried? Carried. Thank you very much. So we'll go back to the agenda then, and the first thing on the agenda then is my verbal report. And tonight I'll be providing an update on our flu immunization, public health modernization, and the Alpha Fall Symposium. So firstly, on the flu vaccinations, as you know, OPH has been promoting the flu vaccine and offering it at clinics across the city. The flu vaccine has also been available at participating pharmacies and through physician and nurse practitioner offices. This year's OPH flu clinic saw an increase of approximately 20% over last year, which is a good indication that residents are getting the message about the importance of getting their annual flu shot. I'd like to thank those board members and the local MPPs who were able to attend on November the 8th, where we had our flu shot party, which was covered by CTV News at noon and broadcasted live from OPH's vaccination clinic. And some of us received our flu shot on camera to help promote the safety and effectiveness of the vaccination. To date, OPH has distributed 251,745 doses of flu vaccine to different providers in the community, not including the doses distributed to pharmacies who receive their supplies directly from a private distributor. I'd like to also advise that the public health will be adding one additional clinic in the city's East End. The clinic will be held at the Henry Munro Middle School, which is in the Beacon Hill area, on Sunday, December the 14th, from 9 in the morning until 2 in the afternoon. I'm told that OPH has received an additional supply of high-dose vaccine for adults 65 and older, which is being distributed to providers and will also be available at the December 14th clinic. and we would look forward to welcoming residents to that clinic, not just seniors, but it's available to everybody. On the issue of public health modernization, I'd like to touch on some developments on the province's plans for public health modernization. On Monday, November the 18th, the Ministry of Health held a webinar to announce details about the proposed consultation on the modernization of public health and emergency services. The panel discussion included Mr. Jim Pine, expert advisor for Consultations on Modernizing, Dr. David Williams, the Ontario's Chief Medical Officer of Health, and Ms. Alison Blair, Assistant Deputy Minister of Emergency Health Service and Executive Lead for the Public Health Modernization. Together, they provided an update on timelines and expectations for the consultation period, and a discussion paper was released to start the conversation. Embedded in the discussion paper are 21 questions. As part of this consultation, Ottawa Public Health, through the Board of Health, will be submitting a response to the 21 questions posed. I understand staff are currently working, I know that staff are currently working on that as we speak, and Dr. Etches will be providing additional details as part of her verbal report. Next is the Alpha Fall Symposium. That is the Association of Local Public Health Agencies, and it took place in early November. Various topics were discussed. We had 2 members attend, members Banham and Tilley, who represented the board at the symposium, so thank you very much for doing that. And I'm going to ask you to just chat a little bit about your experience, and we'll start with member Banham.
Thank you, Chair Eglai. First, I'd like to thank the board and Ottawa Public Health for supporting me to attend this fall's Alpha Symposium in Toronto. As a new board member, I felt it was valuable to better situate myself and better understand our role in the larger provincial context. It was clear that the theme of this conference centered on transformation and modernization. We speak a lot about that. Jim Pine, who has been appointed as the advisor for renewed consultations on strengthening and modernizing public health and emergency health services, and the Minister of Health, Christine Elliott, both addressed the conference. They announced that the consultation period would be coming very soon, and now we have more details. Both discussed the need for a reset and a desire to improve the delivery of public health across Ontario. They heard loud and clear that Ontarians wanted more time and consultation and committed to ensuring that happens. They reiterated that they will not be moving ahead with any set outcomes in mind prior to hearing from Ontarians through consultations. Perhaps one of the most interesting questions posed during the meeting was about modernization and transformation itself. Many alluded to the issues facing public health when discussing these themes, but one Alpha member asked, "Can someone please articulate these issues so that we know what we are going to transform?" Quite simply, it seems that the discussion paper, which was subsequently released, as well as the conversations that will take place within the consultations, will dictate the issues that need to be addressed. I viewed this as an immense opportunity because we know that those who frame the question often determine the solution. I believe that OPH have a role to play in helping frame the issues in order to build a stronger public health system here in Ottawa and also across Ontario. Alpha hosted a panel with those who are at the forefront of change across Ontario. Various contributors to successful Ontario Health Team submissions presented their work. While they did not present, I'm excited that Ottawa Public Health is so engaged in the 3 OHT submissions that have moved forward here in Ottawa and continue to be a partner to submissions that are going through the process. It remained clear that the opioid crisis is on the top priority list for public health units across Ontario. Dr. Eileen Davila, Chief Medical Officer of Health for Toronto, outlined Toronto's public health action plan to address this crisis. They are focusing on 4 pillars, including prevention, harm reduction, treatment, and the people side of the crisis, which includes important issues such as poverty reduction and housing. They put out an overall call to action. I am pleased that at our last meeting we received an update on what OPH is doing to address the opioid crisis, as well as further information about plans for the future. It would be impossible to summarize in 2 or maybe 3 minutes all the important presentations and discussions that took place, but I hope my brief report helps the board better understand the value of our participation at these symposiums, as well as other opportunities to work with our colleagues across the province.
Thank you very much. Member Tilley.
Thank you, Chair. Yeah, it was my gratitude as well to Ottawa Public Health for the privilege of being there. It was very informative. Great to see the push forward from all the regional medical officers of health and sort of a pushback on the province. What a difference, whatever it's been, 8-9 months has made since where we were looking at for June 2020, which is now going to be based on more practical, evidential, targeted direction rather than a budget driving modernization. Modernization will be driven by policy. So that was my that first day was some of the tough questions for the panel and some of the input on defining modernization rather than just going forward with modernization. So it's nice to see us heading in that direction. There was also a commitment from Alison Blair, the ADM for Emergency Health Services, on emergency health and public health are linked together by their municipalities, but there's no intention to merge the two together. To see some progressive language there. A lot of questions on what does reset mean as opposed to modernization. That it was good to hear some of the dialogue around that and the pushback there. So again, some push from some of the people there about can you identify can you highlight what you've identified as the problems that are evident in the current public health system, back 8-9 months ago before you move ahead with some of these decisions. So I too, as Member Banham has said, was really impressed in particular by 3 of the presentations. Dr. Michael Ryder spoke on cannabis use, and he just raised the issue of how with the legalization of cannabis that we've just sort of moved in a direction whereas, years ago, decades ago, it was cool to smoke and drinking and driving was okay, so we've moved society in a direction this way, yet with cannabis use we're moving people back in another way, in a more accepting way. It's a 180 shift when you look at it from many of the medical perspectives of that. So, and our reaction to other drugs versus cannabis. So he highlighted a lot of the usage of recreational cannabis and some of the damage that comes forward, and we've had those discussions here at Ottawa Public Health as well too. So Robert Schwartz, Professor Robert Schwartz spoke on e-cigarettes and vaping, that the belief that it can reduce smoking. Actually we see vaping and cigarette smoking on the increase. That in grade 10 to 12 usage of e-cigarettes is up by 6%, cigarettes up by 6%, and e-cigarettes up by 14%. So some very alarming stats, and just a push again that Health Canada needs to be more proactive in teaching about the harm and risks of vaping. And we're doing a great job here getting that message out as well too. We can be proud at Ottawa Public Health. And then the other one was there was a presentation on vaccination hesitancy, and there's a huge push of groups who are these anti-vaccine groups. They've been asked to take down some of their materials that they were putting up on billboards in Toronto, but they've gained some momentum, and they're certainly effective in some of their push against vaccinations. And other than that, the opioid crisis, as Member Banham talked about, and Dr. Davila's talk, that since 2018, as we know, 4,500 Canadians have died from an opioid-related death. And I think one of the things that was really highlighted was that if we had 300 passengers a month going down in an airplane, we would be saying, stop, we've got a crisis, no, the planes are grounded, but we have 300 deaths a month, at least here in this country, and we're still doing somewhat limited action, on some fronts. So, and her comparison that alcohol, and which is a legal drug, and the efforts we make with awareness, and again, we're doing some great things here at OPH, but people who use opioids are often pushed into unsafe environments because of fear and stigma. That drug use, her final point was drug use is a health issue and it shouldn't be viewed as a criminal one, and we have to be a little more proactive again in providing services and outreach to those people who are drug addicted and looking to use safely.
Thank you, Member Tilley. The Board Secretary will be circulating information shortly about the Alpha Winter Symposium. which is scheduled for late February, and asking for members' expression of interest to attend that meeting. That concludes my verbal report. I'd be happy to take any questions. Member Cloutier.
Thank you, Chair, et merci aux membres Tilly et membres Banham pour leur participation. And this might be answered later on, but I'm just going to bring the issue. I'm happy that the provincial government will have not given a prescriptive solution or way forward in terms of modernizing public health, but there is still their stated goal of reducing their budget 200 million on a total of 700 million, a pretty high percentage. Has a provincial government given any indication on how they intend, if that's still their stated goal, perhaps not this year, but in the years ahead, and how they intend to do that? Maybe the answer is not here, but can anyone?
You're right, that was in the budget announced in April, that they're looking for that kind of reduction in the provincial contribution over time. The way the government spoke about it at that time was that it was to be achieved partly through a change in cost share, where municipalities would pay more and provinces would pay less, not necessarily a removal of all those resources from the system. That cost share change has changed from what they initially described, such that now for 2020 we're planning our budget. We'll talk about, if needed today, that it's basically 70-30 for all public health services across the province. They were looking at different approaches based on size of public health service, and we haven't heard them speak further than 2020. There's been no comment about 2021, about an ongoing shift for 60-40, which was previously discussed. That has not been mentioned since the Minister of Health spoke at the AMO conference in the summer. It's certainly a question we've put forward to the province, trying to understand how we do our longer range financial planning, but at this point we don't have any firm answer on that, other than that they've said they're resetting how they want to modernize.
Any other questions? Okay, can we receive the report then? Okay, and I'm going to ask Dr. Etches to provide her report, which I believe is going to be accompanied by a PowerPoint.
Yes, so bear with me. I'm going to do a little update here. Bonjour, Kwei, everyone. About food affordability and security, some local partnerships and provincial developments, and we'll move at the end of that into some slides about modernization. I think we're at a good point here where we need some direction from the board, and so we'll get into that. So maybe I'll pause before the presentation for any questions on the first part of my verbal update. And so to begin with, as part of the Ontario Public Health Standards, boards of health are required to monitor the food affordability and food security at a board level, at the local level. And so board members received Ottawa Public Health Connection newsletter articles in November and December about Ottawa's food affordability and security using some national food basket data. And based on the 2019 assessment by Ottawa Public Health, the cost of food continues to increase, so 22% in the last 10 years. And this year's survey found that it costs a minimum of $901 per month to adequately feed a family of 4 in Ottawa. And so using this year's figures, families of 4 who rely on Ontario Works for income could have about $138 left at the end of the month after paying an average rent and buying such food. When individuals and families don't have enough money to pay for rent and then the other basic living costs, food does often become a discretionary expense, resulting in a less healthy diet, hunger, and an increased risk of chronic disease and poor mental health. So, ces informations sur le coût des aliments aident à informer les pratiques de santé publique, les politiques publics et les programmes sociaux et nutritionnels de nos parties prenantes. With respect to influencing the local policy environment, earlier today I joined colleagues from the Planning, Infrastructure and Economic Development City Department to speak in support of the official plan at the joint meeting of the Agriculture and Rural Affairs and the Planning Committees. So as members know, the official plan that's being developed now will provide a long-term vision for the city's future growth and a policy framework to guide its physical development into the year 2046. So in speaking at committee today, I affirmed the commitment made by the Board of Health at its September meeting to encourage healthy communities by design by recommending that a public health perspective be embedded in the development of the new official plan. J'étais heureuse de prendre la parole à la réunion conjointe des comités et j'ai hâte de poursuivre nos collaborations avec des collègues de la ville pour bâtir une ville saine. And still on local partnerships, following City Council's approval on November 27th, I am now able to share with you that I've been appointed to the Crime Prevention Ottawa Board. It's a board that does complementary work. The Crime Prevention Ottawa team often partners with us, and so I look forward to taking part in their board member orientation and then bringing a public health perspective and the equity lens to the important work done by Crime Prevention Ottawa. So moving on to provincial developments, Ottawa Public Health is very pleased that the new Ontario Seniors Dental Care Program was launched to support low-income seniors' oral health. We have already received phone calls from community members looking for more information on how to access these services, and the team's been working to support applicants as they navigate this application process. We've hired additional dentists, and other employees have been hired, and contracts are being negotiated in order to be able to provide additional dental services to low-income seniors once the applications are processed by the province. And I have some good news as of today as well. The ministry's advised that our proposal for a new public health unit clinic, an additional dental clinic site, will advance to the next phase of the capital application process. That's not a final approval, but it's moving ahead. In late July, board members received an email advising that Ottawa Public Health was expecting a visit from auditors with the Office of the Auditor General of Ontario, who are conducting a value for money audit to assess how the Ministry of Health, through public health units, delivers food safety programs across the province. À ce moment-là, je me suis engagée à donner une mise à jour au Conseil de santé sur les conclusions et recommandations du vérificateur. And though Ottawa Public Health has not had time to fully review all the implications of the report, I want to flag for board members that findings from the food inspection audit conducted earlier this year were part of the auditor's annual report that was released last week. So overall, the auditors concluded that the health units they had visited, and Ottawa Public Health was one of 5, they had effective systems and procedures in place to inspect food premises and to conduct foodborne illness surveillance and outbreak management in accordance with applicable legislation and regulations. They made several recommendations to the Ministry of Health that focus on improving consistency across the province when it comes to food safety programming initiatives, and including the way inspection results are disclosed to the public, the approach to inspecting special events, as well as follow-up policies and procedures with respect to foodborne illness complaints. And the report provides some recommendations for the Ontario Ministry of Agriculture and Rural Affairs, which is responsible for certain aspects of the food system, such as meat processing, as well as egg and milk production. So we look forward to working with the ministry and partners to implement the relevant recommendations made in the auditor's report. With respect to Ontario health teams, this past Friday, December 6th, the Honourable Christine Elliott, Deputy Premier and Ontario's Minister of Health, was at the Centretown Community Health Centre to announce the first local Ontario health team in the Ottawa area, the Ottawa Health Team, Équipe Santé Ottawa. And Ottawa Public Health is a convening partner of this team, which is led by 6 Ottawa area community health centres and involves over 50 different agencies. I'm pleased this team has made the foundational commitments to keeping a focus on keeping people healthy and well as addressing barriers to health equity, including social determinants. These commitments align well with Ottawa Public Health Strategic Plan. The ministry also took the opportunity on Friday to express support for the Kids Come First, Enfants Avant Tout Ontario Health Team collaboration, which is being led by the Children's Hospital of Eastern Ontario. Specifically, the ministry is going to support moving home and community care for children and youth from the LHIN into the Kids Come First initiative. So the minister encouraged the partners involved in the Kids Come First, Enfants Avant Tout team to work to continue to evolve this continuity and full spectrum of care for children across Eastern Ontario. There are now 24 initial Ontario Health teams that have been announced by the ministry, and so that complete list is available again as of today. And we'll now get further details about the next steps. SPO a hâte de travailler avec des partenaires à travers la province pour mieux définir le rôle de la santé publique dans les ASO et favoriser la prévention dans le système de soins de santé. So finally, I will go on to that presentation, but I'll just pause here in case there are questions on that material. Avez-vous des questions?
Member El-Shanchiri.
Thank you, Mr. Chair, and thank you, Dr. Ashton, for being this morning at the joint meeting. Is your understanding or your involvement, I should say, with the official plan also talks about protecting the agriculture land and make sure the food availability for us will carry on even because this official plan carry us till 2046, so talk about 37 years from now. Is that your role to make sure, or that's outside your scope?
I'm looking over at Inga Rosenthal, who's been leading some of the input into the official plan, but food security, the fostering of a stronger local food system is one of the aspects we think is important for health, and that is one of the kinds of initiatives that we're looking to see in the official plan. I don't know if you want to comment further, Inga.
Yes, thank you, through the chair. Certainly that's a perspective that we've been bringing to the table, the importance of agricultural foods and food security. So that's certainly a perspective that we've been bringing to the table to the OP team.
Okay, well, I personally have, obviously I'm the co-chair of the OP. I'm very interested in making sure public health being on the table when those discussions about food security and availability and protecting the agricultural land, this is all, it fit with the vision of the official plan. So I just want to make sure you have a seat on the table and you're an active participant, because it's important to know whatever we move forward for the next 27 years, the public health has a seat on that table.
Thank you. I'll carry back your support to the Stephen Willis and make sure we continue that partnership, because it's been very strong in the development of the plan. I think what I hear is as the conversations continue, you'd like us to maintain that partnership and influence, and I think he is very open to that.
Member Tilley.
Just a quick question on, it's great to see the expansion of the availability of dental services for seniors. Just wondering, are we accepting seniors who arrive and say they need dental services, or is there a request for them to prove that they're at a low income level when they arrive there, and what would that low income level be, or is it just now available for seniors who request such service?
Thank you for the question. There is income testing required, and Esther has the exact income level at the tip of her tongue. I'm sure I don't. But we do have another service that provides emergency dental services to people who do not otherwise have a means to pay. And that is in partnership with the Community and Social Services Department that we have some emergency dental service support that's available too. So on the income level.
So further to the question on the Ontario Dental Plus program for seniors, the income cutoff is for a single individual is $19,200. For a couple, it's approximately $32,000. There is a process for seniors that are interested to access this service to apply to the province. We're available to support any seniors with that process and with that application. The application is online, and we have paper copies available at various client service centers across the city, as well through our dental clinic, but really would encourage seniors to contact us directly if they have any questions or any challenges navigating this new access to this new program.
So if a senior was living at they could be at a high income level, but we heard the stats this morning, more and more Canadians living in debt, there might be a process for them to appeal or apply for emergency services or other services if they needed dental assistance, even if their income appeared relatively high.
We'll always assess case by case. So if for system navigation. So if it isn't a service that we can do, we're very connected to the dental community to see who can support. So we would just really take that as a case by case as well, and would welcome any inquiries and support to any senior that contacts us.
Okay, thank you.
Any other questions for the first part of the report? Okay, seeing none,
Okay, we'll move on to the subject of Modernization. And Tian, are you advancing, or Jane, you're going to advance the slides, so if you can tip your computer, then I can see where we're at. Or I'll just look behind me. Okay, thank you. Je voudrais commencer par dire que SPO accueille bien la modernisation du secteur de la santé publique. I want to say that Ottawa Public Health welcomes the modernization of the public health sector. We think it's always good to be looking at how we can strengthen our service and how we can use our resources in the best way to meet the growing needs of our population. It is part of our culture, and it was involved in the development of the budget, but to continuously review our services. And we want to find ways, if we can, to be able to reinvest in the ways and services that will make the most difference. So I'm going to, in this presentation, talk about the ministry consultations and then about how Ottawa Public Health is preparing to participate. So at our last meeting, I advised we were waiting for a discussion paper, and that has been released, and we heard about it, that it doesn't put forward any specific prescription for geographic boundaries of health units or a governance model. Rather, it puts forward certain themes, which we'll come to on the next slide, but really the question of how can we strengthen our public health system, given that there are some areas people have previously identified and continue to identify as needing attention. So the next slide puts forward these themes. I'm going to touch on them because they may be small print, but we're looking at how do we ensure there is appropriate capacity in a public health service across the province, whether it's rural or urban or mixed. They're looking at clarifying what service can happen at the different levels of government, whether it's local or regional or provincial or by Public Health Ontario. There's also an interest, which I think aligns with the other health system change we were talking about with the Ontario health teams, in bringing the health care system and public health system and social service systems more closely aligned so that we know health care and social services are linked. priority setting is one of the points the province brought up. How do we do that collectively? Another question of importance, and it's good to see it there, was around how do we better serve Indigenous communities and the Francophone population across the province. So lastly, they do touch on the fact that there have been previous reports and previous recommendations and what might be useful to take from those reports. So that's how the government's laying this out. I don't know if you have questions about these themes, the subjects that the province is putting forward.
Thank you, Dr. Etches. Were they looking for input on these themes, or did they come with, is this part of the reset? Especially...
So as I indicated earlier, one of the things that the Dr. Etches and staff are working on right now is we have an opportunity to respond to the 21 questions, and that's part of the process that's going on now to get comprehensive answers to that.
So I would say in answering the questions which are related to these themes, we can challenge them if we need to. We can say there's some assessment that there's a lack of capacity. Well, we think that's maybe not the case, or there's an opportunity for dialogue here. They do resonate to me. I think they aren't surprising. There is unevenness in capacity across the public health system, for instance. So I think they've picked some things that make sense to look at. What is positive is that it's up to us to put forward how do you address that, what our solutions are. They're not being prescriptive. They're not then saying, so you big health units, you should give some of your resources to the small health units. There's nothing in there that's prescriptive. So that's where I think, as I go through, I have come to some initial thoughts of how to frame our response, and I should have been clear about that. I'm going to get to some proposed key messages, and I'm interested in you just jumping in. This is more of a discussion, I hope, than a presentation, and to see if this resonates with you. If the key messages make sense, then we would develop more detailed response from there. So this is more what the province has put out, and I'll get to what I'm proposing we discuss with them soon. Make sense? Okay. So then, la prochaine, cette diapositive identifiait plusieurs jalons de processus de consultation provinciales. Je m'excuse. Ottawa Public Health has yet to confirm whether exactly when we'll have an in-person consultation, but that is starting. Right now, Jim Pine, Alison, Blair, and Dr. Williams are traveling around the province. They've had an initial in-person conversation with the Thunder Bay and Northwest stakeholders, and we know that they're going to schedule a conversation that Ottawa can be part of at some point. They've scheduled one in Peterborough in December 19th, but that's not one that we're invited to that I know of so far. And so they're aiming to have these in-person conversations happen while the survey is open, and they're going to summarize what they're hearing. They actually think they'll be in a position to report back to the rural Ontario Municipal Association January 21st, some initial thoughts. The survey is open until February 10th. That happens to be the next board meeting date. So that is when we are proposing to bring something further formed back to you for your approval, and we'll make our submission then. We think out of all that they receive, we've been told they will be aiming to have recommendations to the ministry in the early spring. So that will be sort of a next step to react to how they're framing things. So the next slides then go into what we're doing and how we're responding. And so I would say, just as patients must inform healthcare system change, we're looking for the public to inform the public health system change. And so the first way we are gathering information is through an engagement process with the community. And that is, it was launched here. The chair gave his support, was present to have a bit of an open house at City Hall, and then point people towards engageottawa.ca, an online platform to provide their perspectives. That is going to stay open until mid-January, so I hope you got little cards like this and you can promote that within your networks. We're also engaging with key stakeholders and partners, such as the Francophone community, the Réseau de services de santé en français et leurs membres, also the Indigenous community I mentioned, and others. We're using their perspectives and their ideas to help inform our response to the 21 questions, but we're also encouraging them to answer the survey because it's open to anyone. So there's no limits on how many surveys the province is going to receive from different stakeholders. We're going to, tomorrow, the chair and I have an open house for members of council to answer questions and solicit their ideas. And we are, as we mentioned, as the chair mentioned, starting to write answers to those questions. So it'll be an ongoing process of drafting over this period. And so again, I will pause to ask if you have any suggestions for other ways to gather input into forming our response and submission to the province. Looks solid. Good team. You got it right. Okay. On the next slide, j'aimerais passer le reste de cette présentation et discussion sur les messages clés préliminaires qui émergent pour votre considération. So should you support the direction in these preliminary key messages, the team will develop a more detailed response under these categories. So there's 4 categories. We think, though there's 21 questions, we can really answer them under these themes. So I'm going to go into those 4 in a bit more detail, and I'll come back to them at the end. So the first theme of benefits from our connection to the municipality, we have discussed this here before. You passed a motion about the importance of maintaining a relationship with the City of Ottawa, not only because of the in-kind support that Ottawa Public Health receives from the city in terms of rent and human resources and information technology. The list goes on, purchasing, training and development, lots of support, but also because of these close relationships that help us better serve our community. So I'm thinking of things like integration with social services, work with the police services on a neighborhood-based approach, the joint policy work on the official plan you heard about earlier today. Those are other benefits we will touch upon. Next, we want to talk about how public health is delivered locally, and it can be supported provincially. So there are some services that we think can be delivered more effectively by the province, and this maybe gets at some of the language about duplication that the province has put forward. We've identified, that if we could do this, shift some work to the province, that would free up resources to reinvest and address, on the ground with programs and services that meet the needs of our local population. So epidemiology has been singled out with some specific questions about what epidemiology could be provided centrally. And we will want to highlight that we require that epidemiology expertise at the local level to identify local risks, local strengths that we want to build on, to investigate and respond to outbreaks, and to create information that informs local policy development, and sometimes new information to create new surveys or other forms of collecting the data about the health of our population based on local needs. There's another example, I think has come forward, the idea that there could be policy arenas where we need some literature to be summarized. Certainly that literature can be summarized once provincially, but when you're developing policy, you also need on-the-ground relationships to be able to implement that policy, or if it's policy that is approved through municipal councils, to be able to move it through and gain support for that at the local level. We know when it comes to other areas of policy, say school environments, it really requires relationships at the school-by-school level, as well as direction from the Ministry of Education or school boards. So on the theme of collaboration within regions, we're interested in looking at how we can strengthen the public health sector by drawing on those areas of expertise that might exist in different spots and to leverage them for the province or for the region. Whether it's a center or a rural area that has expertise about serving rural populations, or whether it's related to, say, the urban Indigenous population. I think there's more collaboration that could occur. We also know that this is where we could have more access to specific public health expertise. Ottawa Public Health is able to recruit and retain a variety of public health professionals that we're looking at how would we collaborate to leverage that expertise. And so lastly, driving prevention across the health system. I think you've heard this a few times already this evening. The health care system is only one determinant of health, but there is an opportunity now while the health system is being transformed to make sure that we increase prevention, and we'll be describing to the province how we see there's value added of the public health approach with Ontario Health Teams and other work to increase prevention. So we'll go to the last slide, which is just to, again, put those 4 kind of areas for key messages up and to, again, seek your support or your feedback on how we might further develop our response to the ministry.
Member Cavanaugh?
Thank you very much. I find that the best way to make a case is to convince the public and to and push to them why we're so important. I was at the rally on the weekend. Can I admit that? I was about the concern for on public health care cuts, and of course that included paramedics. It's important to remind people of how scary it is if we're not there. And I think that that's something that has to be out there so that people really get what we're about. I'm always amazed when people don't even understand public health. They still need lessons on it. And I know we have tons of examples, and we have an excellent social media department, but it's still reminding people about how important it is. I mean, we're talking to the government directly, but they hear from the public very much, and they've heard from the public already on things that they had thought were good ideas and had to roll back, and I think this is sort of fits into that, and I think that'll continue. It shows that we are a cost saver to them. Some of their measures, as has been pointed out earlier with this presentation on alcohol, they're actually going to cost the healthcare system more, and prevention is key in terms of like the effects of alcohol. That was the presentation earlier we had. So we need more messages out there just driving home how very much we belong here and we're important, and so that's my input.
Okay, thank you. Member Lakin?
Thank you, Mr. Chair. Great messages, I believe. Just a couple of comments maybe to reinforce or to add. I think part of the messaging about benefits to the rest of the health system is reinforcing that public health and health boards are aligned with Ontario Health Teams. Certainly we're on the forefront of doing that, and so if somehow we can message the efficiency of having an alignment between public health and Ontario Health Teams may be useful. And the second is just on the last point about driving prevention across the health system. I might argue that whether it's relevant in the key messaging or not, perhaps it might be that it impacts across public sector system. I'm not sure if that's a message that's relevant, but I wonder if it was relative to what Member Cavanaugh was talking about, is that public health impacts more than just health. It impacts across multiple dimensions of the public sector domain. So just another thought there. But otherwise, excellent. Thank you.
Thank you. All right, can we, oh, sorry, Member Banham.
Sorry, I snuck in at the end there. So I'm very supportive of these preliminary key messages. I'm wondering if you've had the opportunity to speak to others within our region from other public health units and find out kind of what they think of the key messages and if you've received any feedback.
Great, good question. As soon as the discussion paper was posted online, I reached out to the surrounding public health services. So Eastern Ontario, actually, the way it's defined by Ontario Health is 9 public health agencies right now, from Durham through to Eastern Ontario Health Unit up to Renfrew, including Kingston, Peterborough, Haliburton, Kawartha, and Hastings, Prince Edward. And we all agreed that we needed to meet and have a conversation. We're going to meet, I believe it's the 17th. It's next week, and we're going to be looking at the areas in common. So what makes sense? What are our different boards' perspectives? Where are the places for collaboration and common ground? So that'll be an initial conversation, and we'll inform our responses for sure as we're working up to February.
Thank you very much. Can we receive the report for information then? See, thank you very much, Dr. Etches. Item number 3 is our 2020 draft operating budget for the board, and we have a PowerPoint presentation for that as well. So just ask the team to come up.
Good evening. Again, tonight I'm joined by Brenda Gordon from the City Finance Department, and by Sam Gossin, also representing Ottawa Public Health. You will recall that when we tabled the budget with you in November the 4th, we communicated several avenues for residents and stakeholders to submit questions or comments on the draft budget. This included a dedicated email address and telephone number. I can report that as of this afternoon, no communications have been received through either of these avenues. Tonight, as you consider the 2020 draft operating budget, we'll provide a brief overview since our last meeting. There have been no changes to the 2020 assumptions. The City will provide an increase of $475,000, which aligns to the City's guidelines for the 2020 budget development. The budget assumes a 70% provincial, 30% municipal funding for mandatory programs with some exceptions, and there is no provincial funding increase to maintain existing services. All new growth initiatives of $3.6 million are provincially funded at 100%. Efficiencies of $1.4 million are required to balance the overall budget. This next slide, which was presented during the tabling of the draft budget, provides a high-level summary of the 2020 budget changes, and they include a provision of $1.2 million for future negotiation of contract settlements, new growth programs such as Ontario Seniors Dental Care Program for $2.76 million, Indigenous health funding of $298,000, cannabis program support and enforcement of $500,000, and all these programs will be provincially funded. There are also adjustments for the reduction of funding for supervised consumption services of $885,000, efficiencies, and offsetting revenue adjustments in order to balance the budget. Once the board approves the budget tonight, it will rise to council on Wednesday, December the 11th for final city approval, and then be submitted to the Ontario Ministry of Health for consideration. We welcome any questions at this time.
Thank you very much, Lou and the team. Are there any questions? And Member El Chantieri.
Thank you, Mr. Chair. And the 1.4 you talk about in the efficiency, can you tell us how you're going to find that in the efficiency? Like, just a little bit more detail, what's been available?
So we're proposing those efficiencies are broken down into several categories. Again, as stated before, the majority of our expenses are for staffing. So 8.3 FTEs will be reduced as a result of that. And those FTEs are a reduction of administrative support and reduction of supervisory staff. So there's some supervisory areas where staff will be realigned. So that makes the majority of the efficiencies. We'll be looking to eliminate any duplicated services, such as the Research Ethics Board, which is, we'll be looking at different ways of undergoing that area. We're going to be using more e-training. So instead of providing in-person training, we're going to be moving towards using e-training. So we're going to leverage technology a little bit more. And we're also trying to leverage our website. And then above all of that, we're also reducing professional services and cutting some advertising because, for instance, in advertising, we're using social media more. So conventional ways of advertising, we're able to reduce that budget and still deliver the services that we need.
Mr. Chair, my apology, I wasn't on the board last year, but I would like to know how much efficiency the board was managed to achieve last year in efficiency. Was there a target you had last budget, not this budget, in 2019 budget? Was there an efficiency budget?
Well, this 1.4 is a combination of both 2019, because we didn't receive, we assumed a 2.5% increase from the province in 2019, which we didn't receive, so we have to adjust for it in this current budget. And then we're also assuming a 0% increase from the province for 2020. So that's basically amounting to the $1.4 million.
So that's for both years, basically.
Correct.
Now, for the soft costs or some of the soft costs, you call it office administrative, and is there a possibility to work with the city and try to find a way the city can support in a soft cost? Or back office, whatever you want to call them?
We currently work with the city in a lot of different areas, and so we do get a lot of city support, and that's factored into the budget. I think these are program-specific soft costs, and so we're always looking to work within our group and maybe align work differently in different areas in order to be more efficient through the process.
Okay. Thank you, Mr. Chair.
You, Member Giovanni.
Member El Chantieri asked a lot of my questions, so thank you for that detail. I do worry when I see a bucket of efficiencies about what is in that bucket, and it sounds like you have some very concrete ideas, so I appreciate the thought that's gone into that. The admin, the supervisory level, I'm curious, again, being new on the board, how other years, so previous to 2019, what cuts maybe have been made to those areas, because it does tend to be the area that gets targeted, and yet there's really only so much maneuverability there, and what how your admin costs compared to direct service costs, and if that's sort of benchmarkable across other public health units.
Well, we undertook a realignment in 2017, and that's when we looked at the whole program based on the new service standards. And at that point, it was determined what the management requirement and the supervisory requirement was. I don't believe that we compared ourselves to other health units at the time. We're similar to some health units and not to others because of our size. So I'm not sure if Dr. Etches wants to elaborate a little bit more, because she was around at that time more so than I.
Sure. So the needs in our population change, the way we work changes. It just makes sense to continue to review. And, you know, as we move to electronic processes, sometimes you don't need as much administrative support. So I think we haven't had to cut our budget 2018. We actually had a % increase from the province in 2018. So it's just these last 2 years, most recently, where we've had to find that kind of efficiency. When it comes to comparing to other provinces, it's only the last 3 budgets, so 2018, 19, and 2020, where the province is starting to create a template where we'll be able to do that. So it's called the Annual Service Plan and Budget, and the chair looks at it and signs off on everything. And it's detailed analysis is going to be able to be done by the province of cost and staffing levels per program. So the way they've laid that out. We're interested in that. We'd like to know what the benchmarks are for our peer health units. So again, there may be 4 or 5 health units that are about our size. You know, that's relevant for us to compare. So we're looking forward to that kind of information as maybe part of the modernization process of how we learn from each other more.
Member Menard.
Thanks very much, Chair. Thanks for the presentation. I also didn't receive a lot of feedback, but I did on one particular issue associated with the budget. I've raised it with Dr. Etches, but it has to do with the supervised consumption site and our reduction in service there. That's one thing I've been getting fairly regularly. And so I do want to share some information that was passed along to me with regard to this, and also just a couple of comments. So this was shared with Overdose Prevention Ottawa members, and they're concerned primarily with the number of client encounters. They're seeing a noted increase in the service required throughout 2019 per day, is what they're saying. That we've sort of presented a weekly average over a 6-month period, but it doesn't chart the changes in use in the service, and they're concerned about some of the daily numbers. They've raised concerns around the cultural differences between the OPH site and the trailer nearby as well. Although the 2 sites are close together, they're mentioning that the culture of service for users was quite different, and they're concerned that many people who use the OPH site are not likely to feel as safe at the trailer. And in fact, you know, we've acknowledged in our own communications the positive benefit of our client's OPH site in terms of the satisfaction at 179 Clarence, just in terms of a smaller, quieter service environment there and therapeutic setting. They've also raised the fact that, you know, in 2019, the City of Ottawa spent $137 per $1,000 of taxes on the police budget and only $6 per $1,000 on public health, and that there's a real need to rectify some of the inequities in spending. I understand we have a very stretched budget at Ottawa Public Health already, and so it's from a provincial cut that has occurred here, or reduction, it's hard for us to make that up in other areas, because then you end up reducing those other areas. But on their point about the other piece of the budget, it may be something that I raise on Wednesday. It's hard to find this type of funding, though, in terms of what would be needed. At the same time, the point that they're making, I fully understand. And I'm trying to assuage concerns. I've met with the chair as well on this issue when you held your open discussions, and I appreciated that. But clearly there's still some concerns around this. I'm not sure if there's comment from staff around it, but certainly some community members are feeling a bit concerned.
Yeah, I think Dr. Etches can respond to that, or.
Yes, I would like to. It is upsetting if people are needing a service and it's not there, and so we'll probably follow up afterwards with Overdose Prevention Ottawa as well if they have further information to inform our work. We do try to keep in touch with them and support them. the direction we had from the ministry was that we couldn't use our harm reduction funding for supervised consumption. That there's another strategy the ministry has to support supervised consumption, and so it wasn't deemed an eligible expense. So the importance this board recognized of keeping that service going as much as we could is why it's still there, and it's drawing on municipal dollars to do that. But that's not all bad news, in that the province sees a role for supervised consumption. So I think if they're saying not public health, I think what we need to do is make the case for more supervised consumption service through the healthcare system. And so that is something that we are working on. So I'm looking at Andrew as our lead on this file with Kira. The provincial government is aiming to address mental health and substance use, and they do see supervised consumption service as part of that, but it's not available to everyone, and that's what we need to argue for. We need to argue that this is just one of the continuum of services that needs to be in place in every neighborhood. And I would say our experience is on a small scale. You know, that two-booth idea is something that's feasible, not as disruptive potentially, maybe more of what we can get buy-in for across the city. So we will work on that. When you mentioned the investment in police compared to public health, I think that's on our radar as well, in terms of how can we leverage some of what the police are recognizing themselves too, that their workforce can't address all of the health and social service needs that they see. And so I have been working with Steve Bell, our Deputy Chief of Police, and Donna Gray, who's leading our Community and Social Services Department of the city, to look at more of a partnership to learn in neighborhoods of our community where there are greater needs. And I think this will be an avenue to highlight where there are gaps. And it's not immediate, it's not going to help somebody tomorrow, but it will hopefully be a way that we can say we are seeing the need for more supervised consumption services in particular areas of our city where there's not a service, and raise that through different avenues, with police supporting, with social services and other neighborhoods supporting. So I think there's a longer term strategy here where we should see more services develop. And in the short term, we do want to keep our service open and look at what we can do to help transition people if needed.
Yeah, I think one of the important pieces is that the service is not closing in this year. It is changing, but it is still going to be open. It is still going to be available to a lot of our customers, or a lot of our clients, if you will. Part of the rationale behind the hours it is open was in consultation with the clients as to when they thought they needed the service available, and one of the areas or one of the time periods that they pinpointed was in the morning. So we wanted to make sure that we were open and available for them. So we have consulted, we have worked with them, and as Dr. Etch has said, we will be making a real effort to transition as well, to make sure that there are some friendly faces at the other site, that our staff will assist people in moving to that site if need be, if they can't do what they need to do while our service is open, then to make sure that they understand that it is a safe spot. So we've had those discussions. We are working with that. And then to Dr. Etch's point about Deputy Chief Bell, I've had discussions with the Deputy Chief as well, and they are very open, and I haven't had a chance yet at an official level have those discussions with Chief Slowly, but I believe he's of the same mind. I don't want to put words in his mouth, but that dealing with crime in this city is not a black and white issue. It's not good guys and bad guys. There's a lot of social factors. There's a lot of medical and factors that go into it. And I think the work that Dr. Etches is doing along with Donna Gray in her role, and Deputy Chief Bell recognizes that and is looking to move forward that kind of model, that kind of discussion going forward. I don't know if you want Andrew to chime in at all on.
I think he's okay over there.
Well, I'll just comment, I guess. Just thank you for that. That is reassuring, and I don't know if you have more to add, but I think it's good to know that sort of the feedback from our clients around the site that we're operating at 179 Clarence is positive, and that there is an environment there that's been fostered that can help. And so that it's nice to have that example there. Of course, it's a provincial reduction, and we're responding to that. And I guess the question is, why can't we respond a little bit more than what we've seen? But it's hard when there's downloading of that nature that's occurring when we know it's an important service. So I do appreciate the responses, and I'll probably raise it again on Wednesday at council level. I'm not sure if there's more you wanted to add to it, but that was
as the chair was reminding, we have applied for additional funding for safer supply, and we thought we might hear about that in December.
Okay.
We haven't heard yet, so
okay.
Just in case people were wondering.
Okay, thank you, Dr. Hutchison, Chair.
And on that, it's a way of looking at the problem through a different lens. Recognizing there's the issue, but maybe the supervised injection is not the only way to address it. And we've had some good discussions with our federal partners, and we're hopeful that we'll be able to move forward with a slightly different initiative with a different lens on solving the problem, or working towards solving the problem. Are there any other? Yes, Member Giovanni.
I guess just a couple, maybe I missed this in the presentation, so I apologize. I've noticed there's a few areas of significant growth, and one being chronic disease prevention. I'm thinking that might be the new dental positions that are coming in. The other two areas of growth would be substance abuse and injury prevention. Substance injury prevention, and I'm wondering if you can comment on what that growth is related to, and if that is an investment towards the strategic direction, so intentional, or if that is net new money that's coming in. And then similarly, I think the other small area was in foundational standards and emergency management.
Yeah, you were correct about the dental, right on with that one. The substance was the $500,000 that we are going to receive for the cannabis initiative, and the $298,000 was for the Indigenous health funding that the province approved of $298,000 that falls under the foundational standards.
Good, thank you. And so I'm wondering, as part of your budget deliberations, was there any consideration about how to best invest in some of the strategic areas that we want to drive forward that links to the strategic plan? So was there any budget movement to support some of those key strategic directions specifically?
Do you want?
Yes, so we definitely had the strategic plan in front of us, and it was built into the budget principles, which I think are on page 6 of your board report, where the strategic plan was a filter. As one of the principles was prioritizing initiatives that help us advance our strategic plan. When it comes down to it, the majority of our budget, 80% plus, is staffing. And so when you think about how are we advancing our strategic priority of mental health and substance use, it's through people for the most part. And we are doing that across teams. So we have a team that's called the mental health team, and a team that's called substance use, and others that obviously we go to those teams as leading experts. But we're also looking at how do we advance mental health in early childhood in many different places across our organizations, including for employee wellness. And so we don't need to move those team members around. We don't need to change our budget allocations in order to have them focus on mental health as a priority. So I would say you don't see a lot of change in this budget in terms of moving people in different teams, but it doesn't mean that we're not using our strategic plan to put the hours and the time and the resources we have into our strategic plan. Does that make sense? Yeah.
Member Cavanaugh.
Thank you. Our budget is primarily provincial and somewhat municipal. Is there any potential for federal funding, for example, the Indigenous health, or in terms of the cannabis program, since it was implemented by the federal government? Is there any chances of federal funding on these levels? Is that being looked into?
We do have that line in the budget, federal, because we always are interested in growing our revenue and looking at alternate sources. So we do from time to time apply for grant money for the federal government, and that's in process now. We do look to pilot initiatives that are of interest to the federal government. So with the recent election and leads changing at the federal level, we're just reestablishing our links and our relationships, and we'll be continuing to pursue things that align with our strategy.
Thank you. Just one more question.
Sure.
On the current policies of the provincial government, they have changed things in terms of their view on alcohol and making it cheaper and easier to obtain. Does that cost public health even more in terms of promoting safe consumption on alcohol?
We, for those who might be wondering about alcohol, why is this coming up today? We have education sessions before our board meetings, and today we heard about the growing burden of harm due to alcohol in our emergency rooms and hospitals. And so the question of whether that ends up costing us more money indirectly, I mean, there's work we're doing on substance use broadly, and one of those substances is alcohol. And we actually see this as a good time for more impact to raise the conversation about alcohol harms in a more effective way, given that people are talking about other substances, so opioids, cannabis. And actually, we can get more mileage by throwing alcohol into the conversation and helping people realize where the magnitude of harm lies, and potentially turning their attention to alcohol. So we don't have any particular growth related to alcohol specific, but it is growing work as part of our substance use priority.
Thank you. I imagine particularly with the youth. Thanks.
Member Lakin.
Thanks, Mr. Chair. Every year I ask the same question about revenue, and so I'm going to try to ask it differently this year. Having the conversation around budgets is always, it's so frustrating for everyone because there's a fixed pot of money, and every year staff sharpens the pencil to adjust to current situation. And unlike other health organizations, public health appears to be limited in how it generates revenue. Hospitals are lucky. They have boards, they have foundations. Child and social service agencies that provide health services have ways to generate revenue. The police may very well generate revenue through renting of officers, the library, etc. Is there an appetite to explore within the means and the ethical limitations imposed by being a publicly funded body? Is there an appetite to explore sort of an additional sources of revenue that are not conventional? And I think right now we rely exclusively on user fees or training fees for SafeServe, etc. And perhaps it's a question for a year from now to come back to, but it's really a question, is there an appetite to explore additional sources of non-traditional revenue within the means that it's possible?
Thank you for the question. I think it's a good one. And I'm sorry we didn't grasp it earlier if that was the case. I think we should explore how to generate revenue in different ways. It definitely is worth looking at. The way we have previously done that is through grants at the federal level or other research grants. We have applied. There are other grants out there right now, grant applications for funding from the Canadian Institutes for Health Research. In terms of actually producing something that we sell, we haven't looked at that very seriously. We understand in the hospital world you can charge someone for a blue cast or a purple cast. The regular colors are free. Is there something analogous in the public health world? I would say we haven't fully explored that, and we'll take that away this year and make sure we look at some options.
Thank you for the generous answer.
Are there any other questions on the budget? Okay, I'm going to ask Member Cavanaugh to go through the roadmap budget, and at the appropriate time, I'll ask Member Lakin to step away for the particular line-by-line votes. So, Member Cavanaugh?
Thank you. That the Board of Health for the City of Ottawa Health Unit approve the 2020 draft operating budget for the Ottawa Public Health outlined in Document 1 as follows. Page 4, Ministry of Health and Long-Term Care Programs and Standards. 1, Chronic Disease Prevention and Wellbeing. 2, Food Safety. 3.
No, we need to vote on each line, Member Cavanaugh, so if you can pause after each line.
Okay, sorry.
So, no, it's fine. So on 1A1, I guess, carried? Okay. Carry on, Member Cavanaugh.
Okay. 1A2, Food Safety.
Carried.
1A3, Healthy Environments. 1A4, Healthy Growth and Development. 1A5, Immunization. 1A6, Infectious and Communicable Diseases. 1A7, Safe Water. 1A8, School Health. 1A9, Substance Use and Injury Prevention. 10, Foundational Standards and Emergency Management. 11, Program Support. 4B, page 4, Supplementary Programs. Healthy Babies, Healthy Children. 2, Dental Program. Okay. C, page 4, City-Funded Programs, Mental Health, Substance Use, and Injury Prevention. D, page 4, Provincial Programs, AIDS Bureau, Supervised Consumption Services.
Actually, the bulk or the balance of it, you can just read out and we can carry it out as a whole.
Okay, good.
Yeah.
Okay. So IT Reserve Fund contributions, user fees, and number 2, upon the Board of Health's approval of the 2020 draft operating budget for the Ottawa Public Health Board of Health, direct staff to forward the report to Ottawa City Council for consideration on December 11th, 2019, as part of the City Council's approval of the City of Ottawa's 2020 draft operating and capital budget. And 3, upon approval of the 2020 draft operating budget for the Ottawa Board of Health, by the Board of Health and Ottawa City Council, direct the medical officer of health or delegate on behalf of the Board of Health to forward the 2020 annual service plan and budget submission to the Ontario Ministry of Health for consideration based on the approved 2020 operating budget for the Ottawa Board of Health.
Carried? Carried. Thank you. So we're on to the next item, which is number 4, Ottawa Public Health Strategic Plan for 2019-2022, update on strategic priorities. There is no presentation, but there is staff available to answer questions, and I believe Member Lakin asked that it be held.
Yes, thank you, Mr. Chair. It really just a comment. Oh, you can't hear me? Sorry about that. I'll stay up here. Thank you. Just a comment related to the governance element of the strat plan update. As a member of the board, I think this is the first time that there has been an attempt to provide a semi-annual report back to the board on the strat plan. And I want to commend the initiative. I think it makes for improved governance when the strat plan has a reporting mechanism back to the board from which it was derived. And so besides the compliments, I want to ask if there is value at the time in which the indicators, the dashboard is further developed, if there may be value in reporting on a more frequent basis than semi-annually, perhaps to coincide with the quarterly reporting that senior management has, again, to just increase the quality of the governance element of the reporting mechanism and to ensure there's sort of a continuous feedback loop to the board on the strat plan progress. It's not a request, it's just a comment as to whether there's value in it.
So the idea that we would go from reporting twice a year to 4 times a year, that's something we can look at in the schedule.
Are there any other comments or questions? Okay, seeing none. Can we receive this report for information? Okay, thank you. We dealt with the in-camera matters, so Member Cavanaugh, motion to adopt reports, please.
Be it resolved that the Chair of the Board, verbal report, the Medical Officer of Health, verbal report, and the reports titled 2020 Draft Operating Budget for the Ottawa Board of Health, Ottawa Public Health's Strategic Plan for 2019-2022, update on strategic priorities, and appointment of the Associate Medical Officer of Health, in camera, personal matters about an identifiable individual, reporting out date upon Council approval, be received and adopted.
Carried. Thank you. Are there any motions requiring suspension of the rules of procedure? Okay, thank you. Any notices of motion for consideration at a subsequent meeting? No? Okay, thank you. Member Cavanaugh, the confirmation bylaw, please.
Be it resolved that confirmation bylaw number 2019-7, a bylaw of the Board of Health for the City of Ottawa Health Unit, to confirm the proceedings of the Ottawa Board of Health at its meeting of December 9th, 2019, be read and passed.
Carried. Carried. Are there any inquiries? Okay, seeing none. Adjournment. Okay. Merry Christmas, everyone. Okay. And we will see you in the new year on February the 10th.